So Dr. Fox, as a woman who struggles with PCOS myself, I know that PCOS causes pretty much weight loss resistance. It's very hard to lose weight. I know that not every woman struggles with their weight who has PCOS, but every woman that I know does.
Right.
So can you give us just some talk about that?
Sure. So I think maybe at first we should just cover why people have PCOS and what it really means. So insulin resistance means that your peripheral cells are resistant to insulin. Insulin's trying to drive glucose from the bloodstream into cells, primarily the fat cells and muscle cells when needed for exercise. So if the tissue is resistant to that, the blood sugar goes up. And the body is very, very interested in controlling blood sugar. The brain is really monitoring that, just like it monitors your blood pressure, your oxygen levels, all of those things that are very critical for life. Actually, blood sugar is very critical for life. So if you're insulin resistant, the brain says, and the system says, well, if we're not controlling our blood sugar well, then we're just going to send out a lot of extra insulin to get that job done. And insulin is a great hormone to control blood sugar, but that's the only good thing that it does in your body. Everything else is very negative. So if we're going to talk about weight and peripheral fat stores, in that regard, insulin drives blood sugar into the fat cell, and it prevents the system from actually being able to go into the storage fat and bring those calories back out. So your net change is really an increase in fat over time, and that increase results in weight gain. So the only real way to fix the problem is to actually lower the insulin level. And that's where the whole idea of nutrition comes into PCOS.